Good afternoon, my friends, and welcome to our health and safety webinar. And hopefully we'll be getting some good advice, some guidance from Huron Perth Public Health on COVID-19 in the workplace as we continue to roll through this after, well, 2.5 years. This involves health and safety guidance. I'm Eddie Matthews, the General Manager with the Stratford and District Chamber of Commerce, joined today by Dale Lyttle, Senior Public Health Inspector with the Huron Perth Public Health. And Dale, good to have you today.
Thank you, Eddie. Yeah,
How
thanks.
have you been? How and you and the staff, how have you gone through the past 2.5 years? And has it been a lot of working from home as well?
Yeah, it's been a lot of working from home and just a lot of interesting scenarios that that we never really thought would happen, but we pushed through it, and it has been a long slog, but we're surviving here, and people getting good time off when needed and that kind of stuff. So
absolutely, well,
it continues on.
And you're staying happy and healthy, so that's good to see as
so
well
far,
too.
Yes.
And yep. We've got some questions that we wanted to get to, but first, I know that you had a presentation that our viewers will find interesting, so I'll give the floor and the monitor over to you if you want to show this presentation.
Sure. Thank you, Eddie. All right. Well, thanks everybody for allowing us to speak today. Eddie had contacted us at the end of March because I think there was some confusion with some members about public health measures for businesses and organizations now that the restrictions have been lifted. So we've come up with this presentation to walk through some of the recommendations that public health is still considering. It's important, so now that the province has lifted almost all legislative public health measures, it can be confusing on what to do. It's important to note that even though the measures have been revoked, everyone now needs to assess their own risk in their own situation in order to protect themselves from COVID-19. So you might find workers are nervous and anxious about working with public who are unmasked. You might have high-risk clients or patrons that are uncomfortable interacting with unmasked staff, and some might not be bothered by it at all. It's also good to remember that public health measures that were legislated were not necessarily specific to COVID either, right? So many of these are regular infection control practices that are normally used to prevent or reduce outbreaks in facilities such as long-term care, hospitals, and congregate living settings. So the virus is still spreading in the community. It hasn't disappeared yet, and is currently having an impact on staffing in many different businesses, as we've heard in the news, such as St. Mary's Emerge and local school staff, right, being off from school. So like I said, we put together this public health recommendation toolkit for businesses and organizations to help prevent the spread of COVID in these settings. And remember, you also have a responsibility to protect your workers. So Ministry of Labor Training and Skills Development might have some extra resources that you could reach out to as well to help with this, or any other health and safety agencies that you use on a day-to-day practice. So what's the current situation here in Perth? So currently we're in the 6th wave of COVID-19. It's underway with the BA2 subvariant of Omicron as the dominant circulating strain in Ontario. And I don't know how many know about the wastewater study that's being done in Ontario, but this is a provincial wastewater surveillance study being conducted with other key metrics to monitor and forecast the spread of COVID-19 across Ontario. And actually, since August 2021, Huron Perth Public Health has been collaborating with the City of Stratford and the town of Goderich and the Ministry of the Environment, Conservation Parks on provincial provincial COVID-19 wastewater surveillance initiative locally. So this slide here shows the uptake in Ontario. So there are many other municipalities in Ontario that are following the same kind of process. But if you wanted to see what the local data is, we have a few links here in this presentation, which I believe is going to be shared with everybody, or you will have access to this, that you can click on to keep it aware of what's going on locally. The trend is the trend is similar in Ontario than in Ontario. Here on Perth, it does have a bit of an uptake in COVID-19. So the wastewater surveillance is one of many tools that the province is using to monitor for COVID-19 infections, since the widespread PCR testing is no longer available. And the studies have shown that a significant portion of people with active COVID-19 infection shed the virus in their stool. So that's what they're looking for in the wastewater. So by testing the raw water or raw sewage, we can see if COVID-19 is present in the population. So the trend is going up in Ontario and locally. We also are experiencing quite a bit of virus activity in the community. So not only do we have COVID circulating, but we have many different other viruses going on right now too. There's been influenza A reported, adenovirus, human metapneumovirus, enterovirus, rhinovirus, and parainfluenza. Also norovirus, which causes vomiting and diarrhea. Typically, daycares and congregate settings get hit with this. Many of these viruses all have the same symptoms, similar to COVID. So you have fever, cough, sore throat, runny nose, etc. So essentially, our message is if you're sick, you should be staying at home to avoid spreading illness to others. Some of the recommendations we have, so the majority of public health and workplace safety measures have now been lifted as a key public health indicators continue to improve in Ontario. Now, we created this a few weeks ago, and the landscape has obviously changed. It is continuing to rise in cases. But Ontario is now focusing on living with and managing COVID-19. This means that businesses and organizations and individuals must make their own decisions on how to protect themselves, their employees, and their customers from COVID-19. So what the Health Unit is recommending is that people be aware of what's happening locally regarding COVID-19 and other infectious diseases and viruses that are circulating in the community. We have various sections on our website that are really good that you can keep up to date on to assess the risk locally. There's the COVID-19 webpage. There's a specific one for Huron Perth that tells you the local context of what's going on, case counts, vaccination numbers, outbreaks, etc. And the information workplaces, employers, employee webpage that includes this toolkit plus other important information. So as COVID-19 continues to circulate and remains potentially serious illness, and the following groups are higher risk for severe outcomes. So people of advanced age, people living in congregate settings, people with underlying health conditions, people who are unvaccinated. So if your staff or patrons consist of these folks in the above categories or interact frequently with these groups, it is important to consider using multiple layers of public health measures as they not only help to prevent COVID-19, but also other viruses from spreading. So this is the toolkit we created, and it basically runs through all the public health measures that we would still recommend you to follow as best as you can to prevent illness and prevent further spread in the workplace. So who should use this toolkit and why? The toolkit is for businesses, workplaces who do not fall under other COVID-19 directives or legislation. So there's some sectors that still have specific things they have to follow, mostly the high-risk situations like congregate living settings, healthcare, public transportation, you still have to wear masks, that kind of thing. This resource can assist with managing the risks of COVID to your business or organization in order to protect you and your patrons and employees. Topics covered in the toolkit are best practices and are no longer legislatively required. So again, they're best practices, recommended, not required. So the first one is a safety plan. Many might be familiar with this. As we were going through COVID, you had to have a safety plan. This is a really good thing to still keep, I think. This will lay out all the actions that your business is taking to keep workers and customers safe. And it also provides a roadmap for staff to follow too, to make sure that they're doing the proper things to keep people safe. Effective March 21st, the requirement was lifted, but we strongly encourage businesses and organizations to prepare and update these plans. And there's a link there that you can use to get to the plan if you don't know what that is. And essentially, it's easy. You just type in all the things and it'll build it for you. It's not very onerous at all. Next would be screening. We would still recommend people to screen, even though it's no longer in effect. Screening can be an effective tool to decrease symptomatic people coming into the area, mostly for your staff. You don't want ill staff to come in, so that it'll help prevent them from entering and reduce possible transmission of virus to your workplace. So remember, screening comes in two forms. There's a passive screening and an active screening. Passive screening is dealt with through a sign, and this sign is right from the toolkit. So we've rebranded everything in our toolkit to reflect a more managing type of situation. And you feel free to use these signs as you need to. So the passive screening sign can be posted on your door. This basically tells people coming in that they shouldn't be sick or having any symptoms before they come in. Active screening is more when you ask, someone else confirms that an individual has completed the screening and that the results indicate that they can come in. So this is where you would use it for your staff. I think everybody's familiar with that. And again, the online tools are still effective and active on the website, and there's a link there for that if anybody's interested. But we would still recommend actively screening staff people at a minimum. Masks. So as you can probably tell out there, some people are still wearing masks, some aren't. It's kind of all over the place. Although masks are no longer universally required in many indoor settings as of March 21st, they're still a great method of protection from contracting COVID-19. So our recommendation right now would be to continue to wear masks in all indoor settings as much as you can until we're over this hump. The toolkit provides further information on how to properly wear a mask and the different types of masks out there. Identification of sectors in which masking may still be required, like hospitals and higher risk settings. And there's lots of masking posters in there that people can use that we have rebranded again that can be used to educate people coming in or even staff internally. Cleaning and disinfection. This is self-explanatory, I think. The COVID-19 virus plus other viruses can be transferred to surfaces and objects, and people can pick it up that way. Having policies and procedures or a good cleaning schedule would be great in premises to ensure that all those high-touch surfaces are continually being cleaned and disinfected. The toolkit provides resources, policy samples, and important information about cleaning and disinfection in the workplace. Personal hygiene, coughing etiquette, sneezing etiquette. You know, it's not sneezing into your sleeve, getting rid of tissues after you've used it. That's all part of personal hygiene. I think it would be an advantage still to keep your hand-based hand sanitizer stations available for people to use as they come in. It's just an extra layer of protection. This section in our toolkit does have a sample policy that can be implemented in the workplace as well. And educational posters like the one you see here are included as well. Physical distancing, again, similarly, physical distancing is no longer required, but we would still recommend it as much as possible, especially right now until we're past this uptick. The toolkit provides ways to enable workers and or volunteers to maintain physical distance in the workplace. So if you still have barriers, I'd probably leave them up right now until we're over this. You don't need to take it all down right away. Scheduling and other administrative changes can still take place if it's allowed, or if you're allowed to do that in your business. If it if it doesn't impede on your workplace. But people working from home still, if possible, would be still recommended. Providing adequate space for employees and volunteers, specifically around break rooms, lunch rooms, things like that. Using outdoor spaces if available. The weather's starting to break, hopefully, so we'll be able to get outdoors soon enough. Signage and promoting physical distancing is also included in the toolkit. And then there's vaccination policies. On March 1st, there's no longer, Ontario no longer requires businesses and organizations to check proof of vaccine to enter. But you know, the Verify Ontario app is still operational. People probably are still carrying around those cards. You could still check proof of vaccination. I think you would have to have a really good educational or public education campaign to make sure that people are aware of it if you did just decide to use it, because many people aren't looking for this anymore. But you know, you'd have to just see if that's something you want to continue. But we would strongly recommend that businesses and organizations create their own vaccination policies to protect their workers and clients and patrons. Now, if you wanted to go more rigorously and do some mandatory vaccination policies, we always tell you to seek legal counsel for that. And then finally, we've just revamped our events and gatherings guidance as well, to reflect the similar measures that I've already talked about when you're running events and gatherings. So there's a specific fact sheet or guidance for events and gatherings. So this is a guidance document intended to help organizers of public events and gatherings such as meetings, festivals, concerts, outdoor markets to ensure a safe and successful event as we learn to manage COVID-19 in our communities. It goes over various measures to implement, as we've already talked about: screening, masking, physical distancing. Proper preparation and planning prior to and during event is essential. And again, you can access it through this web page if you're interested. And also, just a quick note, if you are running an event or gathering and there's food or drink involved, we still have our special event process that we go through, which is filling out some forms for us to assess if an inspection needs to be done and ensure that food safety measures are being taken. So you can contact our response intake line at this email address, or go online and fill the forms out directly online and submit it to us. So in conclusion, I think the sixth wave of the pandemic is underway, as we have all heard and are aware of. And we're sharing the following messages in alignment with the province. So ensure that everyone can contribute to reducing the impact of COVID-19 by continuing to layer personal protective measures, even when they're not required to. Public health strongly recommends people wear masks in indoor settings. In addition, masks are still required on public transportation and healthcare settings. If you're a recovering case or contact, and for returning international travelers as well, indoor or masking is required. Stay up to date on immunizations, get all those doses that you're eligible for. And if you know you're at risk of severe outcomes, know your eligibility for some of the new treatment options out there. So I think that's about it, Eddie. That's all I wanted to say on that. Yeah.
We're recording this, folks, so if you missed any, you can go back to it. Shannon's gonna post this up on our social media sites after we're done with this. But and I do have a bunch of questions here, Dale, and some of these may be outside your boundaries, so please don't hesitate in saying this is something geared towards Dr. Claassen. She's
Sure.
The health unit is open for people that do have questions, correct?
Yes, I'll just forward the slide here so people can see some of this stuff. You can certainly call our COVID intake line with any questions you have, and they'll either answer it or put you in touch with the right person. We are working in silos pretty much here at the health unit with different compartments depending on what the question is all about. So it'll get to the right person. And then we have a lot of website pages that have a lot of information too.
Yeah. Now, I'll ask this, Pete. It would be a lot of stupid questions here, Dale, so forgive me on that.
No question stupid.
Is the health unit even open for the public to come in, or should we call ahead type of thing?
We are not open. We're not open to the public, but if people need a water sample or have to drop something off, we do have a buzzer. But I don't think we're at a stage where we want everybody just to start coming in asking a bunch of questions. So if it's important enough to show up, somebody would be able to help you. We do have a new buzzer system out front that you can buzz and somebody will come out and help.
And you'll be putting out information too regarding whether some of us that are over 60 can go and get a fourth shot, I guess, soon.
I'm sure. Yep. Yeah. I think there's a clinic today. I see some people out there. I'm not sure what age group it's for, but we typically do run some clinics out of the health unit, plus a lot of the other facilities in different areas too. So
have you thought of putting together like a coffee card where after 7 shots we get a toaster or a free coffee?
Not yet.
just a thought, I think
yeah.
that on. One question that we get an awful lot sent to us because we've got the rapid testing kits and anybody that's watching, please go to our website and if we've got them still on hand, please order away for your business. And that. How do you tell if you should be going to work and how long should you stay isolated? And I guess, does it depend on the size of the business, whether it's a big factory operation or just a small operation where there's only a few people in the business?
I don't know if it would even depend on the actual business, Eddie. Now, this is not my expertise, but I did ask some of the folks about this, and we can certainly provide you a formal answer in writing so I have it correctly.
Yeah.
But there's lots of moving parts to that question. If you've tested negative for COVID, but are still experiencing symptoms of illness, you should be staying at home until those symptoms are resolved within 24 hours or 48 hours for vomiting and diarrhea. Okay. And if you're using the rapid tests, there's some talk about the rapid test not being the greatest. A negative test for rapid tests should be 2 negative rapid test antigens. So you should be testing twice for the rapid test.
Yeah.
Sorry,
go ahead.
No, if you've tested positive, then if you have COVID-19 symptoms or you tested positive for COVID-19 and are fully vaccinated and are 11 years of age or younger, you should be staying at home for 5 days. That's if you're vaccinated. The 5 days starts from the day your symptoms began, and 10 days if you're not immunized.
I'll confess to everybody watching that I had I had come up with a positive test and had it for about a week. I remember it came up positive on the Sunday, made sure I wasn't going to work on the Monday. And I think by the Thursday, it came up negative, but I didn't want to come back to work until I let the weekend go past. So I think that's just rule of thumb as well. Even though you may come back negative after those positive cases, maybe give it a little bit of time before.
Well, Eddie, that's actually another scenario. If you live with somebody that has COVID or symptoms of COVID, you should monitor yourself closely for symptoms and isolate immediately if you have any of the symptoms of COVID. So
I got banished down to the spare bedroom downstairs just to stay away from my wife. So, and you might as well do that.
Yeah, exactly. And isolate away from everybody else.
Yeah,
for the 5 or 10 days.
The vaccination policies effective on March the 1st, they meant businesses no longer had to check proof of vaccination to enter. Can some businesses still refuse customers in order to keep staff safe? Because we've even heard that with some restaurants
Yep.
in the area.
Yeah, that's, I think through this whole thing, we've been getting things like that, even when it was mandatory and people want to do something higher end, right? I think as a business owner, you can probably do whatever you feel comfortable with. I would just caution with making sure that you've checked out all the legal angles to ensure that you're applying it correctly. If you choose to do that for your staff, then you're keeping them safer. But I think like anything we do, there's minimum standards, and you can always go above and beyond the minimum.
Yeah.
But I would just caution them to check to make sure all the angles are covered off.
Yeah.
And again, you'd need to make sure you communicate that to the public.
Absolutely. Yeah.
Yep.
Yeah, absolutely. One thing that you mentioned during your presentation was passive inactive screening.
Yep.
Just give me a definition of what the passive screening means.
The passive screening is simply just posting the sign to allow people to do a check on themselves to make sure that they know they can't come in if they're sick, right? If I'm symptomatic, I shouldn't be going into a place. And if I see the sign, it tells me that I shouldn't be coming in here if I have this, and this. That's what passive is. The active screening is actually asking somebody a question and ensuring that they are not able to come in. So I guess in that situation, passive would be a sign, active would be somebody standing at the door asking them questions.
Yeah. One business owner that I talked to, not everybody was using the rapid testing kits. And he basically said to everybody, if you're not feeling well, assume that you've got COVID. It's kind of a double-edged sword, I guess, is it not? Or is that taking just the precautions, I guess?
Well, I think right now, that's probably what we would say, just because it is in the community. If you are exhibiting symptoms, assume you have it. Use your rapid test kits or isolate until you're feeling better. That's probably where we're at right now, Eddie. Just because there's so much in the community, you have to kind of consider that it possibly could be COVID.
Okay. We've been a few weeks since the March break, and here we are. We're coming up to the Easter weekend. Lots of families and friends getting together.
Yep.
I'm hoping that we're in a better place than we were last year.
Well, there is a bit of a perfect storm coming, a little bit. We have high activity, but we also have a lot of vaccinated folks in our community, right? And so there's lots of protection there. I think people still need to be careful a little bit of who they're around and follow those precautions that I've already talked about. If you are in a situation where you have high-risk folks who may not be able to get vaccinated, you might consider masking, right? If there's a lot of unvaccinated folks around you, same thing. So again, assessing the risk in the situation you're in. It's up to everybody to figure that out now. So
yeah, and we've been through this long enough that people should know that. Anyways,
Yep.
We're coming to the half-hour point, folks, and I wanted to give everybody a chance to ask a question. If not, I wanted to keep this to around 30 minutes or so. I've been pleasant, so please put it in the chat room, and then we'll get to that. If not, well, then we'll just move on in that. But I was going to say, Dale, I've been pleasantly surprised. When I go into the grocery store, I'm seeing still an awful lot of people that are still wearing their masks. And
Yep.
some of the big questions, the big places where a lot of people congregate, I'm still seeing masking in place. So people are wearing their masks and doing what they should be doing at this particular time.
Yeah, no, I agree too. I'm pleased to see that there are quite a few people still following it. So
yeah. Okay. So after Easter is done, is there anything that the health unit is going to be looking for, not only around here, but all health units, just to watch the uptick, or hopefully we've peaked and it starts to retreat a bit?
Well, I'm sure our eyes will be on the next 2 weeks, just like after every spike we had over the last 2 years, right? It was usually around Easter and Christmas. So you can really see that on the epidemic curves. If you actually take a look at some of the historical information now, you can really see those peaks really pronounced on those two areas or 2 times of the year. So yeah, we'll be watching in the next 2 weeks on the numbers and seeing where we go.
Okay. Dale, I can't thank you enough for the presentation that you made here and some good information that you've been able to bring to us. And if people do have any questions, as I say, we're recording this for posting on their social media sites, and we'll pass a copy on to Dale if the health unit would like to post this as well too. But if people have questions, once again, they can go to any of the resources that you've posted here, correct?
That's right. Yeah. And we're working at getting a Q&A, Eddie, on some of the other questions you've asked. So we'll provide that to you once we get a chance to finalize that, and you can post it on whatever you need to post it on, or provide it to all your members.
Yeah. Dale, once again, thanks so much, and happy Easter. I hope you have a very relaxing and a peaceful weekend, and no phone calls from the boss saying we need you down at the shop here.
Yeah, hopefully.
Thank you for this, Dale.
Well, thank you, and happy Easter to everybody, and have a safe one.
Yeah, thanks. Dale Lyttle is joining us from Huron Perth Public Health. I'm Eddie Matthews from the Stratford and District Chamber of Commerce. Thank you for watching.